Next item will be board goals and priorities.
Correct. So what we want to do now is just kind of after you've heard what you've heard today, and I believe Coley said it very well, you know, we know that the past boards and probably some of your priorities are broadband as well as economic development. So we kind of just want to kick it off and, you know, throw out anything that you feel like you want us to focus on. I know we can't do the wrap up of the CIP right now, but we'll look forward to doing that on February 1st or further in that discussion. So we'll just open the floor now for y'all to just kind of, maybe each one of you go around and, if you don't mind, tell us what your priorities are. If you agree with what somebody else says, you know, you can just say ditto. Because I think a lot of our goals are the same. And I feel like hopefully we've presented you information that is going to be pertinent and help you in making decisions going forward with these priorities. So just if the chairman, if y'all want to just throw out whatever you want to talk about, that's what we'll talk about now.
Sounds good. Someone like to start?
I'd like to say economic development is a big one for me in Harnett County. We've got to have growth in commercial and industrial, because that just fuels everything. We got housings going up. We got to have residential, and we got to have the commercial. I think economic development is probably the #1 priority for me.
Mr. Nichols?
Well, I definitely have been thinking and want to look at things on like the big picture on like, okay, what's our ultimate goal? Like, where do we really want to see Harnett County? What are we trying to do? And now let's figure out a way to get to that. I feel like we need to have something that we're actually aiming towards, to set more goals, like specific goals to be on track, that we're actually, you know, have a plan. I mean, if you fail to plan, you plan to fail. Okay, so I really want something that we are shooting for, like a quantifiable bullet, something that we can actually check off the board. And I'm not talking about just a far out there goal. I mean, yeah, economic development, we want to get, you know, companies and all here, but let's just start off with a few of them now and just start checking things off instead of just talking about them. That's my goal for this board. I just want to come up with a plan, figure out where we want to go, and then let's get there in the most painless way possible. So,
Ms. McCoy?
Well, my priorities are the same as it has been for the last 5-6 years, and that is economic development growth here, more jobs for our citizens, more retail for our citizens, because when people's closed, they left us with nothing, unless you could drive to Dunn or somewhere. Also, I know there's a big need for schools here. I think that we should work together with the school board to find ways to come up with more schools. But we need to do it in a collaborative effort where both parties can come to the table and discuss things, and you know, and then both parties make it happen. And my other one is that I know that we are going in the right direction when it comes to creating parks across the county. I would love to see this Shriners Park down here completed. I think that's going to be a valuable asset to the people that's living in Harnett County. I really like that. I mean, the people that's moving in this county is the ones that live here need family recreation, and that will provide it for us. And I know that I talked a lot about the Shouttown Community Center, and a lot of people didn't understand what we were trying to do. I want to say that that center has improved that community, and it has been a valuable asset to the county. That Boys and Girls Club out there, I mean, it is just awesome. I hear so many people talking about it. The PAL, I mean, if you say one at-risk child, That means a whole lot. But I too would like to see when we went out there and presented the plan to the community, we made a presentation for the future. And so far, that's going well. But I want to see that park out there completed too. And it was very, I don't know how to express it, but that basketball goal that you all put out there for all the kids has been a real inspiration for that community. Because we didn't have a basketball goal in Littleton, surrounding area for all the kids. I want to say I'm proud of what you and Colin all have accomplished. But another thing that I want to put emphasis on, we have got to move forward on broadband and natural gas. Simply because the natural gas and the broadband is going to help us get to where we need to be in this county. So that's I know it's a lot, but we can do it. We've done things every year. You always ask this question, and we always present what our wish list is. And so far, I gotta say that we have met that. And especially with the new resource center, I cannot tell you how valuable that is to the citizens that use the library. That library, a lot of people don't go in there, but I went in there at least once or twice a month, and I'm on that board. The citizens of Harnett County have really outgrown that library. So these are things that I'm applauding you for what you have done, and I got a wish list for where we need to go.
Thank you, Commissioner McCoy. Commissioner Witherspoon?
Well, I think I'm probably going to echo exactly what Commissioner Johnson and Commissioner McCoy said. Economic development, when I say economic development, I include broadband, I include finding ways to create jobs. We've got to become an importer of jobs rather than an exporter. I also include under economic development, expansion and upgrade to the airport. I include natural gas. Without those things, we'll have a hard time bringing in new industry. Another priority, I think we've got to figure out what we're going to do with the schools. And I think improving our relationship with the school board and working with the school board to do that would be a plus for this board. And something that hasn't been mentioned is we need to concentrate on veteran services and mental health services in this county. That's something that's drastically needed, and it's something that I think we need to pay a little more attention to. And then last, I was talking with somebody yesterday, and they were talking about this. And I don't know how we're going to do this. We need more workforce housing in Harnett County. Not everybody can afford a $300,000 house. But that's a double-edged sword, because if we provide or seek affordable housing, we end up with below what it takes to support kids in school and provide the services that those same people demand, just like somebody living in a $300,000 or $400,000 house. So we've got a task in front of us.
Thank you, Commissioner Witherspoon. Of course, I echo what has been said by my fellow commissioners. I think after the presentations we heard this morning, it's obvious that we have got to find a way to increase our tax base. We are seeing a tremendous amount of residential growth in our county, as has been discussed all day. We heard the report that the median home sales, if you will, the average home values are not, would not generate enough tax base to provide the goods and services that our citizens expect and that we want to provide. And it goes back to all the things that have been previously mentioned. The broadband effort, the jetport. I'd like to see us work on what Mr. Price talked about with the medical road tying in down 421 with the relationship we have with Central Harnett and the dental and Campbell University. So I think there's a lot of potential here. And I do also want to follow up on Ms. McCoy's comments about the Shawtown Center. That, having been associated with the advisory board for the Boys and Girls Club, I can tell you that that program was doing some remarkable things, and still is. Now, the numbers have really suffered since COVID came, but hopefully once we get past that point, we'll see that program really continue to grow. I think they were up to 80. I think they could accommodate 100 kids. They were up to like 87 prior to COVID, and of course with schools closing, remote learning, they've opened all day rather than just after school. But you know, the numbers and people's fears, of course, certainly are real. So the numbers have been down to around in the 30s, I think. But it's been a very valuable program for our county. And of course, we all know the great job that Powell has been doing, Mark especially, and then Mr. Rowland over in Dunn with those programs. So really good, positive programs for our citizens that I want to commend our commissioners for having the foresight to provide those areas for those organizations to meet. But again, we all know we have a lot of needs, a lot of work to do, and as Commissioner Nichols so well stated, we need to set up and make sure that we can define our direction, figure out a way to get where we know we need to be, and hold course to that foundation, and so we can start making some progress. It's not something that's going to happen overnight. We all understand that, but it's time that we all start working together with our school board and others, as Commissioner Weatherspoon mentioned, to start moving in a coordinated effort to accomplish what we know we need to accomplish for our county and for our citizens. Our challenge, I guess, is to figure out, to clearly define that goal and figure out how we're going to go about trying to accomplish it. And so I think that's what we were elected to try to do for our citizens. And so I'll challenge myself and each of us that let's keep our focus on that and see if we can make progress in that direction.
And I'll just say, too, we have been looking at a strategic planning work session for the board coming up with the School of Government's assistance, trying to put forth a strategic plan for the county. I don't know that there's ever been one, a formal one, done, not since I've been involved with it, so I think that's very important for you and for the citizens.
If I could add one more item to my long list. I was remiss in not addressing transportation. I think while we can't, it's not the county's job to build roads and that type of thing. I think we need to work very closely with CAMPO, FAMPO, Mid-Carolina RPO, and our legislative delegation, and DOT, the Division 6 of DOT, to make known what we need, and let's try to find ways to see if we can get it to happen. It's not easy, but.
Well, we appreciate all your comments, and we'll definitely, put all this down on paper and try to come up with a work session where we can do strategic planning. And it'll be a good time because it'll be budget time. We kick off budget in February, and it'll be a good time to maybe the last work session in February, kind of do a strategic planning session.
All right, thanks so much. Anybody else have any comments or questions you'd like to make before we wrap up and adjourn?
We do need to, Gina's going to pass out the agenda for Monday as well as the
Okay.
appointments needed. We forgot to put that on the agenda, so we do need to take care of some business, if that's okay.
That's fine. Thank you.
Thank you.
To go over the February 1st regular meeting agenda at 9 a.m. On the consent agenda, you'll just see some of the things we've already spoken about, or things that just have to come before you periodically. Item E is the Terminal Area Utility Improvement Project through the Department of Aviation or Division of Aviation. That's the utility improvements needed for the future terminal. So as you see, a lot of times you'll see things come before you because you have to do this before you can do that. So this is one part of trying to get the terminal constructed at some point. Item F is what we talked about, the old detention center separation and demolition. That was spoke about in the capital improvement plan. Item G is the workforce development contract with Triangle South Workforce Development Board. The Sheriff's Office requests approval in item H of the 2021 Harnett County Health Plan. Item I is the Harnett County Health Director requests approval to accept COVID-19 vaccination funds from NCDHHS. Item J is the Health Director requesting approval of some new fees. So anytime new fees come up, they have to bring it before you for approval. Item K is the Health Department requests approval of the revision to the clinical patient fees eligibility and bad debt write-off policy. That's actually currently being routed. If we don't get it routed in time, we'll pull that for the next meeting. And then item M is General Services requesting approval of the funding agreement between NCDOT to execute the Jetport Master Plan update. And again, that one's going through the internal review process as well. And when I say internal review process, just so you know, it starts in our office. Well, it actually starts at a department level. They send it to our office, and then it gets routed to finance and IT and risk management and HR and legal before it ever comes back to you. So just, oh, I'm sorry, that's being routed. Okay, item L is also being routed.
That was a two-part process that we did at the last meeting, so we're just following up with that.
Okay. And then we'll add item 7 will be the CIP discussion, so we will add that onto your agenda. And then item 8, under the county manager's report, Kimberly, I'm not sure if we've got the Veterans Treatment Court financials.
Yes, we received the final invoice that we were waiting for. We received that yesterday, so we'll get that. We're trying to wrap that up today.
Okay, so we'll get that put on here at your request. And then I did want us to briefly discuss, and this is up to you, you can tell me take it off or leave it on, the COVID-19 paid leave for employees, and then the use of the AV equipment in the new meeting room and what that's going to be about. Well, both of those, I'll give you just a little brief information. So the COVID-19 leave, the federal legislation ran out December 30th of 2020, and so whenever people are out now with COVID, either they have it, they're quarantined, they're having to take their own time off. And several of our employees have gotten it while they were at work. So it's really, the county gave them COVID, and now we're telling them to go home, and they don't have any leave, so they're having to go on leave without pay. So it is impacting some of our employees. So I just wanted you to consider possibly implementing a local COVID-19 leave policy for employees. A lot of counties have done that since the other leave had expired that we were getting paid for. And then the next item, in the new building, we will have a lot better technology than we have in this room. There'll be the cameras that can go to whoever's speaking, kind of like if you're ever in like a lecture hall or any kind of, big setting. So I just wanted to know if you wanted, like right now, it's pretty hard for the public to understand who's talking or what's going on. So in the new building, we can actually activate the video part as well as audio, and you can see them, not the people at home, but if presenters, you'll be able to see them and they'll be able to see you, which we cannot do in this current room. So that discussion will be, do you want to do that or not? And if you want us to, we probably won't have it ready in time for Monday's meeting, but the following meeting, we could potentially do that if that's what you, and also we have that in our conference room, the ability to do that as well for work sessions. So just kind of, that's just what the discussion will be about.
Thank you. Any questions anybody has for Ms. Stewart about the agenda?
Mrs. Stewart, on the COVID leave, you put that on the agenda for Monday. Couldn't we not discuss that and settle that here?
We have to discuss it at a meeting.
Let's discuss that at a meeting.
Well, we can discuss it now if you want to at the retreat, but we can vote on it at the meeting. If y'all would like to, definitely, okay.
Because,
That's fine.
I need to know, I understand that employees have used their personal leave that are sick and all of that. But then too, I want to know how that, financially, how that's going to affect us.
It really wouldn't be, all you would be doing would be granting administrative leave, local administrative leave, which you have the authority to do. If we ever close because of a hurricane or bad weather, you just kind of go ahead and you pay employees for that time. We already have it budgeted, so you're not really, it's not really an extra cost.
Okay, I don't have a problem if it's not budget, but I just, well, that's a question I wanted to know.
How is that granted? Like, I mean, do they have to, like, do they just tell you that they contracted positive?
No,
Or do they
currently,
have to send in?
yeah, there's, in fact, if you want me to get Chris, Dwight, if you'll get Chris, if he's available, we can get our attorney to explain what we have done up until now, and I've also been speaking with him about this going forward, how we'd have to change our policy to include this, but what happens right now, the person has to fill out a form, and they send it over to our risk manager in HR, and they tell like that I'm going to have to, I need to be out because of COVID. And you can't ask, there's a lot of questions we can't ask, so they just fill out the basic information. Their department head knows about it, and then it comes to Chris in legal. And we've been, that's how it's granted. It has to be signed off on by everybody. Chris, do you mind explaining, we're talking about the COVID, possible local COVID policy for paid leave. Can you tell them kind of currently what we've been doing, and then when the leave ran out? Yeah, that'd be great. Sorry to put you on the spot.
Okay, fine. So, under the law that's passed, under emergency paid sick leave, it offers employees up to, I believe it was 2 weeks of paid leave. It'd be paid in full, the full amount of their salary for if they are quarantined or isolated due to COVID-19 or caring for someone who's under COVID-19. They get partial pay if they're out for taking care of a child or so on. But in general, the idea behind it is to provide leave for those who are in isolation or quarantine due to the disease. So that act was good until the end of 2020. So effective January 1, it is no longer available. Even if you started it December 30th and went into January, you only get those 2 days. It doesn't carry over. As of right now, there is no legislation to extend that. The $900 billion COVID relief package that was passed in December did not extend that. And so, as of right now, all employees, if they get COVID-19, have to use other accrued leave. Now, our policy, our COVID-19 policy does allow you to take any kind of leave that you have available, sick, your vacation, comp, any accrued leave that you have available to you. So I know we discussed internally of what to do, because we still obviously have employees testing positive, or they have a family member that tests positive, so they have to stay at home. And especially for those employees who don't have a lot of accrued leave. So again, they may end up extending emergency paid sick leave in the next package. I don't know at this time. And I don't know when that, if they do decide to extend it, I don't know when that package will get passed. So felt the need to bring up to the board to decide whether we want to offer something very similar. We can't extend emergency paid sick leave under the federal act, but we could obviously adopt something essentially the same requirements, same amount of time, or or different period of time, in addition to just our regular leave policy that you accrue each month. So.
And Commissioner Nickel had asked, what is our current process? And I was telling him how the employee has to fill out a form and send it over to, if you go over that a little bit, that'd be great.
So we developed forms for it. So I have to complete it, send it over to HR for approval. Now, under the law on emergency paid sick leave, we can't, there's only so much documentation we can require. Essentially, if they just tell us that they tested positive, we have to take that as is. We can't require doctor's notes and so on. Or extended amount of, we can't ask for just an extended amount of documentation on, just enough to say that you actually are subject to quarantine isolation order. It does have to come from a health care provider, which under the law is pretty broad. Our health department, doctor. If you go to a pharmacy and get a COVID-19 test and they tell you isolate until you get the test results back, it's a health care provider telling you to go home. So that's how the approval process works, is if someone tells you that you need to quarantine or you tested positive, fill out that form, gets approved, and then you're eligible for up to that maximum amount of time. Now, if you can telework in the meantime, you don't have to take anything. You can use it incrementally. You take work 4 hours, take off 4 hours, depending on your condition. You may not be able to work an 8-hour day, but that's how that works.
Chris, this is Brian Haney. Can you talk about the limits on that leave? Because it's not just an unlimited amount.
Right. It's up to, I believe it's 2 weeks of paid leave. So again,
80 hours.
80 hours, right, yeah. Sorry, I don't have the policy in front of me. But if you use it at one time, if you tested positive or you isolate because someone else in your family has it, you use that full amount of time. 3 months later, someone else gets it, you got to isolate again. It's not available to you, so it's not a renewing thing. So under the federal law, it's a one-time thing, use it or lose it, and it's gone. So that'd be another consideration, whether to allow recurring use if you have to isolate multiple times. But under the current law, it was just, you get up to 80 hours and that's it.
Well, COVID, it's a cruel thing. And I know that we have to take care of our employees in this county. That is a must. So as far as I'm concerned, I make a motion we do it. Not now. I know we don't have to do that now, but I think it's something that's much needed. Because this is not going away. It's not going away, not no time soon anyway. But I got one more question to ask. Are we making sure that employees here are working in a safe environment? And what I mean by that is using all the tools that we should be using, the masks and all of that. Are they doing that in the different departments?
We're not monitoring. We're leaving that up to the department heads to monitor because we can't be in all the places at one time. But every meeting that I have, every email I send out, everything that John Rouse or Larry Smith sends out, we remind everybody this is what you're supposed to do. We're a government agency. We send out the 3 W's all the time, reminding people to wear their mask, wash their hands, and wait 6 feet apart. So we're doing all the right things. I can't promise you that everybody's doing it, but if I see somebody not doing it, I do call the department head. If I see people in vehicles or at lunch together that are county people not wearing their masks, I take care of it. So if I see it, I try to handle it. I can't speak for every single person, but they've been told and retold. So we're doing all we can. It's just some people,
That's the question I was asking simply because we're not going to get rid of this virus until we do what we are supposed to do. We have to be responsible for ourselves.
And we do have all the, as you can see, partitions up. We have all the physical barriers we can do. We're letting people still telework. The telework policy's been in effect now for a very long time, and we're still, as you heard earlier from Brian's report, we're still getting the job done even though people are teleworking. So we've really, thanks to IT and all that, we've had to really strengthen a lot of our resources in order to do that. But it's paying off because nothing's not done because of COVID. I mean, we're still moving forward, and a lot of our buildings are still closed to the public. They're by appointment only, because again, we're listening to the state and the CDC guidelines. So,
And there's something else that I want to point out about us trying to take care of employees as much as we can is under emergency paid sick leave. The federal law allowed you to exempt frontline workers, so EMS, healthcare providers, jail staff, police, and so on, were exempt. However, we voluntarily decided to allow them to use it for reasons 1, 2, and 3 on their policy, which is for the exposure, being told to isolate, and so on. So we did do that as well to try to help out employees, which we were not required to do under the federal law.
Thank you. I think you're doing a wonderful job.
Anyone else have a comment about this matter? I will say that one of the things I know our county government has stressed, and certainly our school system is stressed with employees from the beginning, is the desire that everybody be up front and make people aware when they think they may have been exposed or whatever. I would fear that if an employee who is out of leave time but needs the income to pay the bills would be much less willing to come forward, let's say, until they were convinced or knew they had the results of that test. So I think if we don't consider something like this, then we're, in essence, this is not a good term, but forcing it underground, so to speak, because, if I'm not really sure, I'm thinking, well, let me make sure. So anyway, that's just some thoughts along that line, that if we want to continue to have the expectation that they're going to be up front, let us know so that we can hopefully stop the spread of this thing, then we can't expect them to not be able to pay the bills when they think they might, but they're not sure. So that's just my 2 cents on the topic. Any other comments on that? But we'll certainly discuss that.
We can move
on
it
Monday.
up if you'd like us to. We can move it. We can move it from county manager's report up to number 8 or somewhere on the agenda if that's what you would like to do. And if you'd like Chris to bring a policy, a local policy before you, we can do that as well.
I think based on the discussion I've heard, I think it would be good for us to make it a separate item.
Okay,
For consideration.
we'll do that.
And at that time, I can present to you, just various obviously options of a one-time allotment, allowing it for multiple use, so on. There are things we can discuss more and I can present a policy to you.
Very good, and certainly would want to, I personally would want to consider frontline workers who are highly susceptible, let's say, to having repeat occurrences, or the possibility of repeat occurrences, and possibility of consideration to, but anyway, the legal parts of that, to have that option for a director to maybe not a frontline worker, but to have that option for them to grant an exception if they think it's factually relevant, so to speak, if that makes any sense. So.
Yes, sir.
And also, if you would like it to have an expiration date, we don't really know when things are going to be different, but if you wanted us to, we could draft it to end June 30th, just because that's the end of the fiscal year, and then readdress it in the new year, if that would.
I think that'd be a good idea, and hopefully it'll be included in, when something else done, and they'll let us go back and retroactively utilize that. But if not, I think it's the right thing to do.
And I was going to ask you that too. Do you want this to be retroactive to January 1, since that's when the start of the new, some people have already had to be out starting January 1 and forward. So that's something else for consideration. We can bring that up on Monday.
Yeah, we can talk about that on Monday as well.
Thank you.
Thank you. Any other items or questions or comments? Mr. Weatherspoon?
I've got a couple of questions. The VTC financials, will you email us those, or?
I will provide them to Gina, and she puts them in your package. That's moving forward. That was a suggestion that I had made. You feel free to change that if you need to. But to do, you had asked for it quarterly, and we would include that under the manager's comment, so it would be included in your package each time. Thought if you want to, we can review that first set, and then afterwards we'll just include them. That's okay.
Okay. And item G, the Harnett County Workforce Development. Is this workforce development, is this through CCCC?
It
It's an
is.
annual contract
It
that we
is.
do every year to provide all those services. Yeah, it is through that, yes.
Now, JobLink is our
Right.
agency that helps administer the program.
Right, and the employees, they're all federally grant funded. So it's all just, but it says Triangle South Workforce Development Board, but that's also, CCCC is who they contract with to do this.
Charlotte Leach is our director for that. So that's
And
just
Rosalind Cross is the director under CCCC that works for
Triangle
Triangle South Workforce Development Board.
Okay.
Right.
So this doesn't really have anything to do with the workforce development work that Mid-Carolina does?
It is the same program.
It is?
It is. So
Okay.
what we're proposing for Mid-Carolina, once they get the Cumberland County Workforce Development Board underneath their umbrella, we would entertain possibly switching ours over if it goes well. So this is still up for, but we have to renew now because it's a federal grant and it's a deadline that we can't put this off.
Okay.
So we'll do this one up until the time as we discuss it with Mid-Carolina.
I just wanted to
Yep.
understand what that relationship was there.
Yep,
Thank you.
That's exactly what it is.
Thank you. Appreciate
And
that.
the last thing
question, Commissioner
the
Wilson.
last thing we got is appointments, I think, that we
Okay.
had, and then if there's other business for y'all, that's fine too. So if you just look over your appointments and make sure you're okay with them, these will be what will be put forth on Monday as well.
Hey, Mr. Nick, you have anything? No. Mr. Johnson? Mr. McCoy? Mr. Witherspoon?
Yes, sir.
Okay. Ms. Stewart, anything else from you or the staff? Well,
Just appreciate your time and attention today. We know it's a lot of details, a lot of information to cover, but thank y'all for your attention to it and good questions and good priorities and goals going forward. We look forward for onward and upward.
right, thank you for the information. It was very well presented. At this time, hearing no further comments, could I have a motion to adjourn?
Mr. Chairman, I make a motion that we adjourn.
Thank you, Mr. Witherspoon. Do I have a second?
Second.
Thank you, Mr. Nichol. All in favor, say aye.
Aye.
Aye. All opposed? Motion passes. Have a good day.